My 16-member physician group is abuzz with the recommendation to use hydroxychloroquine to treat COVID-19 coronavirus infection. And the majority, I think, and the overwhelming opinion is there's just not enough known about hydroxychloroquine in the treatment of COVID-19. Just not enough known. And it probably should be avoided until scientific research drills down on it to the extent that we know it's both safe and effective in treating this vicious infection. There's no question we want to get something. We want to get it as soon as we can. But scientific research, randomized controlled clinical trials just aren't done overnight. And so until we know more, probably best to avoid it. In a companion video, I talked about the side effects of hydroxychloroquine. And this is really why research is so important. It's all about safety. Before it can be approved by the FDA, we need to know how hydroxychloroquine behaves in the face of treating COVID-19 coronavirus infections. What happens in the human body when somebody has this vicious virus, this virulent virus in their body, and we add to that hydroxychloroquine? We simply do not know. We know the side effects of hydroxychloroquine in treating rheumatoid arthritis and lupus, the cardiac arrhythmias, the bone marrow suppression, the fulminant liver failure, that it might cause blindness. But we don't know what will happen when it's utilized in treating COVID-19. And that's why research is so critical. We have no clue. And this is imperative. It could be devastating. The effects of hydroxychloroquine treating COVID-19 coronavirus infection could be devastating. The bottom line is this: might more people die and suffer long-term consequences from the combination of treatment with hydroxychloroquine and the infection COVID-19 coronavirus than fighting the virus alone. Not everybody dies from coronavirus infection. In fact, it's a fairly small percentage. So maybe going it alone is you're less likely to die and you suffer less long-term consequences due to the combination of hydroxychloroquine and COVID-19 coronavirus. So it's really, really critical that we, as we treat, we must research. But we can't do that willy-nilly. We must first do no harm. And it's critical for all physicians during this time to heed that, despite the fact that we'd like a rapid cure, that we'd like to do something. We went to medical schools because we want to make patients better. We want to save lives. And it's awfully hard to go through the anguish and awful pandemic feeling like there's not more that we can do, but we must heed the mantra of first do no harm. This is an awful and horrible pandemic. And we just gotta hang tight and work hard, work together with everybody. You know, I don't have the pedigree of Dr. Fauci, who graduated from Cornell University School of Medicine, nor the pedigree of Dr. Fauci and Dr. Briggs, who spent their life at the NIH. But I did graduate from the University of New Mexico School of Medicine. I did my residency in family medicine at Brown. I completed an academic medicine fellowship at the University of North Carolina, Chapel Hill. And I received a Master's of Public Health degree from the University of Liverpool. I've spent nearly 40 years in the trenches taking care of patients and doing what I can to make them better. And so my pedigree as I work in the trenches currently, treating patients during the COVID-19 coronavirus pandemic, my pedigree is good enough for them. This is Dr. Jim for Be Healthy, Be Happy. Listen to the CDC. Wash your hands. Observe the 6-foot rule. Socially distance. Practice random acts of kindness. Use hand sanitizers. Get some exercise, some good nutrition. Hang tight. We're going to get through this together.